Hello friends, today I am live on the occasion of Doctor's Day. Now this is very important day. If we really love our health, this can be one of the most important day. Now why I am live on this particular day? Because doctors are the symbol, or I don't know what to exactly call, but ideally they are the symbol of God. Doctors are the symbol of God, or to be realistic, they were the symbol of God. So this is a very serious issue, but then I will like to give a different perspective on this. I would like to give a different take on this. Most of the people nowadays are looking for quick fixes. Most of the people are looking nowadays for shortcuts. Most of the people are looking for least effort cure. But my dear friends, all of this doesn't exist. It doesn't exist. And sadly, the medical profession is a divine healing profession. Now it is taken in the perspective of law as a consumer and a salesman relationship. Now this has actually killed the genuinity of healthcare. Now let me put it to the right perspective right in the front. If we talk of consumerism, you go to a shopper stop, for example. You go to shopper stop, you just take what you want and you return happily with goods, right? You consume them or you throw them, doesn't matter. But same is not the thing with healing or healthcare. How many of you agree with me that everybody, each one of you are equipped, with your own healing abilities? Now this is, I'm trying to take the right take on this. I'm trying to take the genuine perspective on this. So your body has a healing ability. How many of you agree? How many of you agree that you are born with a healing ability? And I hope if there would have been 10,000 people on live right now, everybody will agree that they are born with a healing ability, right? Suppose you are a kid and then you are trying to ride your bicycle for the first time and you have a fall, a nasty fall. So you fall on the ground and there are some scratches and bruises you are having. Do you really need to go to doctor every time? Or many of the bruises, most of them will heal automatically. What do you say? Heal automatically, right? If they are very bad, if they get infected, then only you need some external help. Otherwise, simple abrasions, simple bruises are self-healing. Why? Because body is installed with that ability to heal. Body, or you are born with that ability to heal, right? For example, you go outside and get drenched in rain, get wet in rain. Nowadays it is monsoon, so it is very appropriate to relate to this. So you get out, go get inside, get in the rain, you get wet, and then you get headache or maybe upper respiratory, not exactly infection, I will say nasal discharge, rhinitis, or maybe some body ache. Do you need medicine every time? Just think for a minute. Do you need medicine every time? No, you don't need medicine every time. You may or may not take medicine and it is going to be a self-healing journey because your body is installed with that capacity to heal, right? Another example, if you go with your friends, you are in a very happy mood, in a celebration mood, you go for a party in a hotel, you go for a very good restaurant, or let me 5 star, anything. But this somehow that food was not of the great quality. and it disordered your stomach. So some out of 5 people, all will not get exactly vomiting, but some one or two may get vomiting, one or two may get abdominal pain, or some discomfort, or some acidity, or some kind of loose motions. So you have some kind of, remember, some kind of disturbance due to external factors. But most of these disturbances, do you really need medicine to get out of it? Hello Abhijit Jamkindikar, hello. And great to see you here. So do you really need medicine to come out of every problem? No, my dear friends. Your body will throw out 1 or 2 or 3 vomiters or 1 or 2 loose motions, and you will be perfectly fine very next day. After a limit is crossed, after this response, the body's response gets out of control, then only you need a medicine, right? Now here is the point which I want to make. When healing or health depends more on you, when healing or health depends more on your ability to heal, when healing or health depends more on your internal immunity and strength to fight the disease, why so large hue and cry over doctor patient's disturbed relationship? How can you bring this to consumerism? See, you go walk into the shopper's stop and then you take goods and bring it home and use it because these goods are there at a shopper's stop, right? But healing is something which is very, very internal. And what do you think? Who will be healed better or who will be healed first? One who keeps trust, one who keeps faith, one who is in a right state of mind, one who is surrounded by right circumstances, one who is having very cordial relationship in family and home and office, who will be healed better. Whatever doctor does, but healing is always going to be subjective. Healing is always going to be subjective. Now why I am stressing this point? Because ultimately you need to realize, we need to realize, everybody needs to realize that healing and healthcare will always be subjective. It is meant to be. It was never meant to be talked about with the notion of consumerism. It cannot be. It is inside. So healing lies inside. So if some patient comes to me or goes to any doctor with lots of doubts and fears and suspicion, can you please tell me how many chances are there that he will be benefited by right treatment? Although the right treatment or the perfect treatment, whatever it is, how many will be benefited? Now this is the biggest point, because nowadays health diseases and healthcare have been a topic of suspicion, unfortunately. Now if you surround this such a divine healing science, if it is surrounded by doubts and fears and suspicions, will the healing improve or will the healing deteriorate in quality? Now I want this as an answer from you. What do you say? See, healing is going to be subjective, but the problem is that the mindset, the consumerism approach is killing the healing, killing the healthcare. Because for example, if somebody is having a problem, gallbladder stone, right? Now gallbladder stone can get dissolved if pH is changed, right? I don't know how it is going to be done. Let us just think. If they are dissolvable stones, they are not a solid, tough, and it is not like tough stone like a kidney stone. It can be dissolved with the change of pH. Now, most of the times they are suggested surgery, and for all the right reasons. Because if gallbladder stone persists for quite long, they have a risk of malignancy. Agreed, and agreed. But a pathology, a problem where there is a possibility of cure, a problem where there is possibility of cure, should some doctor ever try to relieve this patient, or straight away we should go for surgery? Now, if you look at the consumerism of it, you should go for surgery. Forget whatever cost it bears on the patient, whatever the cuts and whatever the risk patient carries, doesn't matter. You should go for directly for surgery, take out the gallbladder and hand it over to patient that, see, I have removed your gallbladder, whatever the sequence is, whatever the result of this is. Now, if this patient comes to a doctor who knows how to treat it, if this patient comes to a doctor who knows how to reverse this stone formation tendency, if this patient goes to a doctor who knows the non-surgical treatment of this particular problem, now should it give a fair try? Now, as soon as I use word try, somebody will say, it is a try and error and try and error. Come on, dear. Nothing can be ever said as a guarantee in healthcare. Because ultimately healing depends on somebody called you. I am not safeguarding doctors here. No. What I am trying to bring the point in front of you is that healing lot depends on you. However your doctor may try for you, but if you do not cooperate, if you are not in the right state of mind, if you fail to give you right information, doctors can't do anything. Now, why I'm giving the ownership towards you? Because you own it. You own it. Health and healing and healthcare, you own it. Nobody else owns it. But unfortunately, something which is very internal, something which is very subjective, something which is present inside us, we are looking outside. What do you want? For example, if some patient is having migraine, he will go to the doctor for a magic pill, right? Say, oh doctor, I'm having severe headache, do something, and doctor gives a tablet and that pain is gone. Great. Is it a temporary relief, or is it a permanent result, permanent cure, or a reversal of disease? Now, I know I am touching to the very, very sensitive point here, but then the doctor has done his best at that moment of time. He has relieved the pain, right? Next episode you go again it is relieved. Third episode you go and then he gives you a prescription that whenever you are in severe pain, take this, otherwise take this. But suppose this patient is having some problem, if this patient is having some problem at his office or at home, lot of stress, lots and lots of problems at home, what do you think his headache will be behaving like, right? Bhalchandra ji, namaskar. During last 6 months I am under your treatment, but during the initial 3 months there was some improvement, but at the end of 6 months I am back to square one. Yes, this can always happen. Thank you for discussing this here. You have given me something very important to talk about. I will definitely come to it. So with respect to migraine, or even Mr. Bhalchandra's case, or any case, there can be situations in life which may bring you back to those complaints. Suppose, for example, headache can precipitate by the bad circumstances of life. For example, if somebody is having diabetes and if he is having stress diabetes, will it not be affected? Suppose I am treating a patient of diabetes, right? Now let us take to me, why to talk of anybody else? So if I am treating a patient of diabetes and he is getting nice response and suddenly his life situation changes. Suddenly his life situation changes and he gets some problems. He gets some problems in family, he gets some problems in business, he gets some problems in boss, maybe he loses his job, maybe there are frequent property matters and disputes in family. Now tell me, with all kind of hell of disturbances in family, will it disturb his diabetes and blood sugar levels? This is no brainer. It will disturb, right? Now, if this happens, should we, doctor and a patient, sit together and see how to solve, or should we get disappointed, or should we blame each other? What should exactly happen? Because see, whatever happened in that person's life is not in doctor's control. How a doctor can control your business loss, or how a doctor can control what happens between husband and wife at home? And stress is the biggest culprit for all the diseases, and you know it better than me, right? Everybody agrees that stress can cause diabetes, that stress can cause hypertension, that even a huge shock can even cause cancers. It is clearly mentioned in psycho-oncology that cancer happens in mentally disturbed people, divorced people, and who are single and stressed. Why? It has been clearly mentioned because mind is playing the role. So similarly, mind plays role in most of the diseases. And if mind is playing role in most of the diseases, can you tell me, it is whose mind who is playing the role? I can't hear you. It is whose mind which is playing the role? Doctor's mind or your mind? Come on. It is your mind, my dear friends. It is your mind which is playing the role. So at this moment, patient's responsibility is to talk with doctors why this is happening. That there can be reasons. There can be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 reasons. And good news for you is that all the reasons, all the problems are solvable problems. They can be solved. Come on. There's nothing great in it. Stress and mental situations and life occurrences are going to come to disturb you. Come on. You are not the Iron Man. You are not the rock person. You are a sensitive human being. Life situations are going to come and disturb you. But then it is going to also disturb your health. But then it is also going to disturb your values and readings. And then it is going to also change your health status. And then it is also going to affect whatever doctor is doing for you. Now at this moment, thank you Balchandra ji, thanks for your appreciation. I am here with you. We will be discussing whatever happened with you and why you have come to square one, right? So we are at advanced, we care for you. You must remember this word. We care for you, but we care for you we can care for you only if you care for yourself, right? So thanks for being with us here. So what I was talking about is that life situation. See, life is not fair. It is not going to say, oh Mr. So-and-so, you are taking treatment. So let me give you 1 year of uninterrupted mental state. Will it ever happen? मतलब क्या है, काश के ऐसा हो जाता. Please God, शायद ऐसा हो जाए. It will never ever happen. Come on, don't over expect. Life is going to test you. And when life is going to test you, you know who can be your best friend? Do you know who can be your best friend? Your doctor can be your best friend. Because if you allow, he understands. He understands you. If you allow, he understands how your life situation can affect your health situation. He understands that whatever problem you are in, you can come out of it. He understands how to solve if something is getting over your head. And he understands that you deserve to be in a better place than this because you are sitting in front of your doctor. Now, my dear friends, what I am trying to give you back your friendly doctor. I am trying to give you back your trusted doctor. I am trying to give you back your faith on doctors. Now somebody is going to definitely say that every doctor is not good, right? And then somebody will say, no, all doctors are bad. This is a fashion statement nowadays, right? People love, somehow it is obvious in the media. The media is the biggest culprit, one of the. So it is very obvious that nowadays all the hue and cry are against doctors, right? Now let me just ask you a simple question. Hey, are you there? Good morning to everybody. Now this is a question for you, right? Suppose you say all doctors are bad, which I don't agree. See, let me tell you about me first. I am having 22 years of experience in active practice, and in healthcare I am having 26 years of experience of watching healthcare very close. I had worked in so many ICUs. I have worked in so many ICUs and hospitals and seen everything very close. I know almost a best specialist in my city in every field, in every department. And trust me guys, this sentence is going to shock you. I know the critical care specialist, I know the best diabetologist, I know the best neurologist, I know the best gynecologist, I know the best surgeons, and I proudly say here, I love them. I really love them. More than I respect, I love each of them because they have taught me whatever I know right now. But then, in this 26 years of closely watching the healthcare, I am yet to find a single doctor who deliberately spoils patients' health. And never found any. And never ever found. Why? Because it's a rare breed. It is very, 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 very rare to even think that doctor will try to spoil your health. Come on. He is trying his best. But he is not God. If you approach your doctor with faith, love and trust, you are going to get a better health. If you approach your doctor with lot of doubts and suspicions and fears, you are not going to get a better health care. Trust me guys, doctors do not manufacture medicine inside their, I will say, the living room or bedroom. Medicine is all prevalent there, it is all available there, and doctors give the best medicine as far as the protocol set by WHO. It is mandatory, come on! It is mandatory by World Health Organization, the protocol has been given and it is given like that. Right? They are trying their best. Now you will ask me, okay, we were on some different topic. I have never find a single doctor who deliberately tries. Suppose if patient is there, okay, you are Mr. So and so, I will try to spoil your health. देखते हैं इसके बाद तुम हेल्दी कैसे रहते हो, मैं पूरी कोशिश करूंगा कि तुम्हारी हेल्थ खराब हो जाए. ऐसा सोचने वाला डॉक्टर मुझे आज तक नहीं मिला. Nobody ever tries to, right? So nobody ever tries to spoil your health. There is no doctor. In 26 years of closely watching the healthcare, I have never found one doctor. None of you, none of you have watched medical science so closely than me. I have worked inside. I have worked inside the ICUs. I have seen inside the doctors, and trust me, most of the doctors I have found are genuinely godly creatures. They are godly creations. I have so many mentors. I have so many physicians. I have so many physicians, surgeons, and mentors among allopathic school of medicine, and I trust them at times more than I trust myself. They are so good. But some of what we are expecting is that once a patient goes to a doctor, he should be alright, or doctor is a culprit. Come on. Now let me tell you a story. Obviously, this is a simple story which will open up your all the senses, right? Let me tell this to you. Suppose there are two doctors, Dr. A and Dr. B, right? A Dr. B or Dr. X and Y, what is better for you? We will say, okay, Dr. X and Dr. Y. X gives some spooky feeling, isn't it? So there are two doctors, Dr. X and Dr. Y, right? Now Dr. X and Dr. Y both have 26. Okay, they are my contemporaries, right? Both have seen medical healthcare closely for 26 years, and both are genuine and hard, and both are fantastic people, fantastic person, and immense knowledge, right? Dr. X decides that I will use all of my knowledge to help people who are fighting death, who are fighting for life, who are critical. And Dr. Y decides to play the safe game. Dr. Y says, no, I will not take these kind of cases which can die. I will treat only upper respiratory infections, sinusitis, conjunctivitis, maybe some kind of fevers. That's it. Wherever I find risk, I will send that patient to Dr. X. Now tell me, Dr. Y is doing justice with his knowledge, or Dr. X is doing justice with his knowledge? Dr. X is having profound experience, and he is trying to help where the help is most needed. When somebody is dying, he needs somebody experienced to come there and try to help it out, and try to apply his experience, try to apply his all the sensible wisdom gathered in these 26 years and help the patient to come out of it. Dr. Y is trying to escape his responsibility. Dr. Y is trying to keep himself safe. Dr. Y wants to be safe at all your cost. If some patient comes critical and Dr. Y says, no, you should go to Dr. X, I don't treat this kind of patients. Now all the critical people are going to Dr. X, and all the simple problems, acidity or running nose or sinusitis or body ache or simple viral fevers are going to Dr. Y. Now my dear friends, who is taking the actual responsibility? Who is taking the responsibility? But then the problem starts here. Dr. Y will enjoy no problems. He will counter no problems. But then Dr. X has taken responsibility. His ICU is full of critical patients, and one patient dies there, and his hospital is thrashed. He is beaten. Come on. Who is going to take the responsibility then? Now this is a serious problem. Now many of Dr. X have started thinking to become Dr. Y. Now what to do? Because they have a sense of fear when they treat you. They have the sense of doubts when they treat you. What do you want? Your doctor should be with a sense of fear and doubt when treating you, or he should be with a sense of love and affection and care for you when he treats you. My dear friends, please trust me, we are spoiling our health care. Because what I think in 26 years of experience, what I have gathered till now is that the best healing can happen only with love, care, affection, friendliness, bonding, relationship, rapport, and an unbridged trust. How many of you agree with me? How many of you agree with me that the best healthcare can happen when doctor is in a state of love and care and affection and trust, and doctor should be positive and hopeful about your recovery first. Now this is the right point, and I don't know how can somebody don't agree with this. But what we are trying to get quick fixes. Trust me, there are. Now you can write this down. Right? Take this. Take the notepad and write this down. There are no shortcuts. There are no quick fixes. And once for all, please note down, doctors are not God. They are humans. They are humans who have studied the maximum. They are humans who have given the maximum part of their life learning and learning and learning. Now, when I see back at my career, when we passed 12, one of my friend who got less percentage than me joined engineering, completed engineering in 3 years. How many years? Completed engineering in 3 years and immediately got placement with a 6-figure salary after 3 years of his 12th class HSC. If I compare me there, after 6 years of graduation, not 3, 6 years of graduation internship, we need to do, not exactly that I have gone for post graduation, let me think of some super specialist doctor, right? Maybe some super specialist in neurology, right? He completes his MBBS after 6 years, then completes his MD, then goes for DNB, then goes for double DNB, then does some under practice, and after almost 18 to 20 years of hard work, he starts his clinic. He starts his hospital. Come on. This man have given most of his life trying to be a better person to treat you. Doctors have given the best part of their life. Do you know when most of the graduation students are enjoying life, most of the doctors are having sleepless nights? Not doctors. Most of the medical students are having sleepless nights. I remember when we were studying, we used to do complete night study for most of the days. I am not talking of exam days. I am also talking of non-exam days. Do you know? And with this changing scenario, what a doctor will feel? That I have spent so many my youthful years where I could have been enjoying life, studying for all these people to save their life, to do best in healthcare, to help them best, and what I'm getting? I'm getting doubts and trust and suspiciousness and thrashings, and few doctors are also beaten up. God will never forgive such people. God will never forgive such people. Because let me tell you reality. Government data says admission to medical colleges have fallen down drastically. It is government data. Admission to medical colleges have been declining over the period of years, and now they are at the lowest levels. I will ask you one question. In this scenario, how many of you will really advise your kids to become doctors? How many of you will really advise your kids to become doctors? And see, you are representation of India. You are representation of the educated Indians who prefer to be educated and communicated while social media, and you are live with me on this live Facebook. So you are the aware peoples, wise peoples, intelligent peoples, responsibility taking peoples, right? Now my question to you is that how many of you really will advise your kids to become doctors in this scenario? Come on. Yes, Nilesh says agree. Bhalchandra says I will. Yes, Bhalchandra, I trust you. You will. I know. Thank you. So come on, the answer is going to be dangerous for you. See, we are increasing population democracy, right? And doctors' population is decreasing day by day. How are we going to support our healthcare? Do you ever think of our nation when doing such kind of activities? Do you ever think of, I can't say few words here, but those who are behaving like this with doctors, are you going to make your son or daughter a doctor? This is my stern question to you. Are you going to make your son or daughter a doctor if this kind of behavior continues? It was always better to be something else and get a job and okay, fine. And this is happening nowadays, that most of the people will never advise their kids to become doctors. They will advise them to be a businessman. They will advise to take the job. They will advise them to be a pharmacist or do anything else in the world than becoming a doctor. So trust me guys, with this kind of changing scenario, the person who is suffering the most is the patient, one who needs it. We need good doctors, right? When we need good doctors, we need to have good perspective to them. We need to help them. We need to be with them. We need to cooperate with them. I agree, there may be few doctors who are not at par with this godly feeling. I agree with you, completely agree with you. But can you tell me, is there any profession in the world which is completely clean? For those who say that doctor profession is now maligned and so kind of a thing, right? There are so many people who will say this, that the medical profession is now more of a business and all, right? But then, can you tell me, which profession next? I will name few profession. Can you please tell me the profession which is cleaner than medical profession? I will say, okay, the policemen are absolutely fair, isn't it? The policeman, the job of a policeman is to help people, and they are the cleanest. There is no corruption there. There are no bad people there, and it is absolutely clean. I will say all the policemen are absolutely clean with no corruptions, right? Or judiciary is perfect. Judiciary is perfect. See, judiciary profession is something where nothing wrong happens. There is always a justice for everybody, and there is everything fair for everybody, right? Will you agree with me? Can you name any profession? Come on. There are some problems in every profession. There may be some problems in medical profession. But God doesn't come on earth. He won't come on earth. He will help you. He will help you if you approach with right attributes. And He has created somebody. He has created somebody called a doctor who wants to help you. Doctor always wants to help you. You go with any problem. For example, somebody goes with a high blood sugar. Doctor will always try to bring that blood sugar down. He will never try to make that blood sugar worse. But if some reason happens and blood sugar goes up, you will be angry at your doctor. Right? Doctor never tries to bring your blood pressure more higher. He will always tries to bring down. But then if you get a stress of your life and your blood pressure increases, you will go and say, doctor, you are giving me this medicine, still my blood pressure is high. Come on. How can a doctor be responsible for that? He's always trying to make you in a better state of reports. Some are trying to give you better reports. Some are trying to reverse your disease. Some are trying to cure your disease. Let them try their best. Don't stop them. Because if somebody does like this, everybody asks for a guarantee of health care. Yeah, doctor, you are treating me, so what I want a guarantee. How much you can give me guarantee that I am going to be 100% alright? Come on, this is not a salesman's job. If you want a guarantee, there is only one person in the world who can give you guarantee. Do you know who is that person? It is you. Only you can give the guarantee that you can recover from this health problem, health issues. Same is with life. If you are having some problems in your life, can you tell me who can give you guarantee that you can come out of that problem? There is only one person who can give you the guarantee that you can come out of this problem, and that person is you. Similarly, in healthcare, there can be only one person who can give the guarantee. There can be only one person who can be held accountable. There can be only one person who can be held responsible. There can be only one person who contributes maximum to your health issues, and that is you. Doctors are there to help you. Doctors are there to guide you. Doctors are there to bring the best knowledge available to you. It is your choice to go for a temporary health care, or go for a permanent health care, or go for over-the-counter medicines, or go for allopathic medicines, or try for cure with homeopathic medicines, or try for example, we are working in the best of the combinations of treatment. We are working in advanced genetic holistic treatment. Come on, it is your call to get the best, or try for the best, or not to try for the best. But nobody else can guarantee. Suppose somebody joins with me in my advanced genetic holistic treatment, and I'm very happy to say that this is one of the best treatment available in India. I'm sure about it. And in every seminar I almost say this sentence: if you can find a better treatment than this, I will do treatment for free. This is my statement which I do always, because we have combined something called genetic based treatment with mind, with beliefs, and with mind reprogramming, with subconscious reprogramming, and we have India's best mind reprogramming health retreat with us. We have all these combinations brought in place for the best people like you to get the best health care and change your life. But if you don't cooperate, then what? Or if your life situation doesn't support, then what? If you join with me and you get the worst part of your life, then what? If you join with me but your family quarrels continues forever, then what? You need to take responsibility. Doctors will be always there for you. As far as I know of my team, I have a team of almost 15 to 16 doctors. We are working in almost every metro city, and all the cities we have dedicated doctors, and these doctors are treating from the heart. We don't have any doctor who treats only from brain. They love you, they care you, they will try their best for you. They will sacrifice their lunch and breakfast and dinner and their life, their happiness, their family for you. Not for you just to say something negative to them. Right? You need to cooperate. You cannot just blame. This is true about every doctor in the world. You cannot just blame doctors for everything happening on the earth. Come on, grow. It is time you grow, because your health is nobody else's responsibility. It is your responsibility. As is said in business, that my business is my business and none of your business. Make it sure that you say in healthcare, my healthcare is my business and I am ready to take the complete responsibility of my illness, and I will come out of it. I will find a doctor who will help me come out of it. If I feel that this doctor may not help me, I will find another doctor and another doctor and another doctor. Don't try to find a guarantee giving doctor, because it doesn't exist. It doesn't exist. Just yesterday, Ram Sharma ji, thank you for your, you give me energy to fight with my medical problems. Yes, thank you for your nice comment, inspiring comment. Yeah, Maheshwari is there. Shweta Bansur, you are great. No, Shweta, this is actually the people who are with me on this, the burning topic discussion, they are great. So, I will take this moment, this comment to congratulate you all for being on this Facebook Live, because here I am talking about something which everybody must do, taking ownership of our problems, taking responsibility of our problems, taking ownership of our health issues and life issues, taking responsibility of our health issues and life issues, and trust your doctor. If you see that you can't trust your doctor, just change the doctor. Maybe somebody else trusts that doctor. It is our subjective feelings, right? So with this, what I want to convey the message is that if I have some problems in my life, you cannot be responsible for that. Only one person can be responsible, and that's me. So if you have some problems in life, you are the only person who are responsible for that. Right? Now we are drawing ourselves towards a wrong kind of healthcare. Now let me tell you an example. This happened just yesterday, right? Hi Khetsing Tang, yeah. Now he is one of the Khetsing Tang. I am very happy the way you approach in the treatments. Thank you, really thank you for that. So I will share an interesting story with you, right? Yesterday I got a patient with obviously unsatisfied relative. So they came to me, and when in my absence they came to some of my doctors. Now their complaint was that your doctor, a doctor I trust, she is with me since so many years, I trust her completely. She is a gem of a doctor. I trust her completely. She said, your doctor didn't insist hospitalization. Now we have a hospital here, and we see that we try to be absolutely as genuine as possible. My every team member will always try to be as genuine as possible. Now add one sentence in front of this. As genuine as possible as per medical knowledge, not according to patients. Because patients have different set of mindset, and it is usually not right. It comes from Google, or it comes from so-called neighbors, or so-called adosi padosi, the super duper specialists. They carry their own notions which may be wrong. But doctors need to be ethical from inside, from their mindset and their heart set. So I trust my doctors completely over this, and that patient was complaining, your doctor did not insist that I need to get hospitalized. I said that the problem must not be that severe then. So problem was that she was having low blood pressure. It was 90/60, and she was having headache, and she had some sun exposure. Right now, that BP of 90 or 60, there are many females who will get slightly lower blood pressures, and when they had sunstrokes, not exactly sunstroke, it was labeled as sunstroke later on, but it was sun exposure, and slight low BP is okay with the perspiration a lot. So she gave some medicine and give some advice of that if it increases, you should get hospitalization, and if it is more, you can go with some IV fluids, because sunstroke is not a disease. Sunstroke is not a disease, it is a condition, right? So IV fluids, you may need IV fluids, so you better take it. Patient said, no, I will not take IV fluids, I will not take hospitalization, and my doctor didn't insist. Why? Because that blood pressure was 90, it was not 60. If it would have been 60, she should have insisted that no, this is 60, it is dangerous, it may kill you, get hospitalized right now. Now that patient was angry because doctor didn't insist, and they went somewhere, and then some doctor said no, saline lagana chahiye, aisa karna chahiye, waisa karna chahiye, and they got IV fluid, and then they were happy because they got IV fluid there. I asked them, doctor told you you should take IV fluids and get hospitalized. Why did you listen? The answer was simple. She didn't insist. Now this is the big problem. If doctor insists on something, it is a big problem. If they don't insist, it is still a problem. My dear friends, can you tell me, how should a doctor treat? How should a doctor treat? In this era of doubts on doctors, it has really become difficult to give genuine suggestions, right? And the only one person who suffers is a patient. So fine, sir, I'm really sorry that this is going long, so let me cut it short here. There is only one way to get the right health care. Do you want to know? There's only one way. First, do your research, all the research, Google, Doodle, whatever you want to, and find a doctor. Find so-called right doctor as far as your mindset. As far as me goes, most doctors are right. But find a right doctor as far as your mindset allows you to. And then trust on that doctor. Yes, then trust on that doctor. Trust on the doctor and follow his instructions with complete faith and belief, and you will see your health changing, right? So with doctors, I would like to share only one sentence: be as you are. Be as you are, and if you feel that you are not getting the right kind of patient, change your approach. Yes, change your approach. Now I am lucky, and thanks to all those, I will take this opportunity to thank to every patient all over India and abroad who is attached with me in some or other, because you have trusted me. And trust me guys, you have trusted me for 100% efforts, not obviously 100% cure, because I am not God. You have trusted me for 100% efforts, and I promise you 200% efforts. That's a promise from whole of my team to you. We have always done this, and we will always do this. The only thing we have changed the approach is that we are now all over India searching for right mindset people. We are searching for right mindset people, and fortunately all over India we are getting this right mindset people. So thanks to each one of you who have ever been associated with me. I must thank for this 22 years of exceptional relationship with me, between me and you. And fortunately, I have always got, I don't know how, but I have always got the best kind of people for my practice, in my team and everywhere. So thank you for each one of you. Thank you for each one of you for trusting me Thank you for each one of you for listening me and following my instructions. If you see again, go back to whatever we have talked, it always made sense. Otherwise, we would have never talked, right? There are some of my patients are already here. Ketsing Tang, we have been together for one of his relatives, which was actually very difficult case, and we went with the consensus that I don't know really we can treat this patient or not, but we will give a fair try. And thanks to Ketsing that he supported awesomely. He supported very well because we were very transparent about it. Then Abhijit is here. He is an awesome man. When we were into treatment, he was an awesome sport. He supported every part very well, and he got excellent response. He has referred so many patients, and see, we are committed at core, but there are few things which are not in our control, right? So we want your help to control your health, right? So we want your help to control your health. We can bring the best of world to you. We can bring, and we are bringing the best of world to you. But to get the best result, I need to elevate myself to the best level of a best doctor, and you need to elevate yourself to the level of best patient. I am sure you will, right? So thank you, my dear friends. Happy Doctors Day to all the doctors right here. You have done so much of sacrifices. I can understand, and some of your caring patient can always understand. Be the best, do the best, be the caring doctor, be the loving doctor, be the best doing doctor, right? And for all the patients, try to take your responsibility. We are there to help you out. Thank you.